data person. We're really going to dig in to, first of all, what's going on in Colorado, what we know about it, what's informing the decisions that we're making every day, that I'm making to keep people safe, to help our economy return as quickly as possible to normalcy. We're also going to talk about our command structure and how the state of Colorado, who's stepping up and how those roles work. Because this is important information to know for everybody as to what we know about what's going on today in our state with the hard facts and data that are so critical in this crisis. Before we get to that, as you know, we're doing everything we can to ensure that people are able, who want to safely work during this crisis. Through our Division of Insurance, we were able to act to be able to temporarily remove red tape and delays to allow restaurants to be able to use some of their staff they might have laid off, like bussers and wait staff, as drivers. So rather than have to go through the corporate insurance policy, they can use their own individual insurance. We want as many people to be able to work as possible. We've waived many licensure requirements, many regulations, so that people are able to, first of all, in the critical workforce, deploy their needs as nurses, as doctors. If they practice in another state, they're automatically licensed here. If they're expired, we get them back. They're temporarily renewed. All of those things are being done. We have a whole team that is working every day on what barriers or regulations can we remove or streamline to get people out there working. So really excited about that restaurant announcement today. We've also been getting a lot of questions from the press and the general public about stay at home, so I want to do a few points of clarification before we dip into the science of the virus in Colorado and what's happening. First of all, as a blanket statement, it's important to everybody understand the stay-at-home order, that this is not a competition to see what you can get away with. Right? We rely on people complying with the law. It's not a time to figure out how close you can get to the line. It's a time for all of us in our individual lives to instead decide how few people can I interact with in the next few weeks? How can I limit the number of friends or acquaintances or strangers that I'm coming into contact with? That's the contest, folks, right? The contest is to say who can best comply with the spirit of this. Don't worry so much about the letter. Let's try to compete to figure out how all of us can stay away from more people to the extent we possibly can. And just to stay at home is the guidance unless it's absolutely necessary. It's also important that if you do go out, you keep your distance from others. You wash your hands frequently, properly, with soap, 20 seconds, wipe down surfaces, and use common sense, everybody, right? We need to use our best judgment to err on the side of your own safety and the safety of others. There's some age-old wisdom that applies here. If you have to ask yourself if something is smart or safe, then it's probably not. So use common sense. I trust you. We trust you. Ask yourself if you need to do it, if you need to associate with other people, if you have to go out, and try to alter your own schedule and habits to contain the spread of the virus. Treat this disaster, and I'm here at the Emergency Operations Center, which is the center in the state of Colorado where we handle disasters. Treat this like you would a tornado or a flood or a wildfire or a hurricane. This is every bit as serious, and the loss of life is going to be far greater than many of those other events that we've experienced here in the state of Colorado. And the more non-compliance there is, the more people are not heeding the advice to stay at home, the longer and the more severe this crisis will be, because the data will guide us. And it's not that we're looking at you, but we're looking at the effective actions collectively on how they contain the spread of the virus with all of the data, which I'll get into in a moment. So we really hope that everybody sees this as an urgent competition to reduce your own interactions with others, physical interactions, as much as you possibly can. This is an executive order. It is law. The foundation of our society is the rule of law. Residents who suspect that if an establishment is violating this order, you should contact your local health agency immediately or law enforcement. Residents can also file a report with the Attorney General's office at covid19.coag.gov, and particularly if local law enforcement or public health is not responsive. And if you need to recreate, and we love our outdoors, do it in communities close to your home. This is not a vacation. Just because you're not working, this doesn't mean it's vacation. Just like a tornado or flood is not a vacation, this pandemic is not a vacation. It's not the time to drive 2 or 3 hours from Denver to mountain communities, many of which are reeling from the crisis. Let me add that that is really dumb because those communities have a higher rate of infection than where you live. So the last thing you should want to do is drive to your second residence or a hotel or a cabin in the mountains. Trails are often narrow and people need to be at least 6 feet apart. But just as you wouldn't go out in a tornado or flood or hurricane, again, you need to focus on staying at home and see this as a challenge to see how fast Colorado can get through this and return to normalcy. You know what? Our mountains and canyons have been here for hundreds of thousands of years. And they're going to be here for hundreds of thousands of years. So wait until this blows over to enjoy them. This is not a vacation. We need to have patience. Stop putting yourself and others at risk. Of course, maintain your physical fitness and engage in that you need to in physical activity, but please be careful and judicious. I also know how important faith is at this time. I've had 2 calls with clergy leaders from across the state. I have another one this evening. And we also know that our houses of worship really function as community centers. And in a crisis, a war, a famine, a flood, we often value that fellowship that brings us together in our houses of worship. And as I've expressed to our faith leaders, and they're in full agreement, and many took actions well prior to any state actions, this is a different kind of crisis. A pandemic is one in which their fellowship of worship is needed more than ever before, but the very physical proximity that is the usual avenue for that fellowship is the very danger. And so they are thinking out of the box. Our priests, our rabbis, our leaders of all different denominations in our state are engaging in broadcasting worship services and offering telephonic services. This order very clearly allows places of worship to broadcast, to allow a camera person and a sound person. We are trying to keep those gatherings to 10 or less using electronic platforms. Our faith leaders are innovating every day. And last week I challenged them to innovate, and it's amazing to hear the inspiring stories from across the state about pastoral services, worship services, ways to engage in worship consistent with worship practices, but putting a new way of doing them on it that saves lives. I want to say why this is so important. Because people often gather in faith settings, that has actually been a primary vector for contagion in Korea and India. In Korea, through a particular denomination, one individual led to hundreds of cases. In India as well, which has an even more severe lockdown than our country does, and is a potential tinderbox with over 1 billion people, many of their cases stem from one pastor that then passed it along to hundreds, if not thousands of people. So as with everything, of course, our churches, our institutions of faith are more central than ever in a challenging time. And I encourage everybody to engage collectively. That means socially with friends. My son had a virtual play date with another 8-year-old today. It means, of course, participating in worship. And it means not going out unless you have to. And taking steps to ensure that our churches, our synagogues, our mosques, our temples are able to function in new and innovative ways electronically and have the ability to have the limited gatherings that they need to further their important role in this crisis. It's also important to clarify that parents transporting children to comply with parenting plans is of course allowed. Those are not exempt. If you have shared custody, those need to continue. Fulfilling online orders, exempt. And of course administering our democracy itself. Elections, participating in election functions, those are critical government functions. We are not sacrificing our democratic republic for this virus or any virus, and all of these activities are allowed under the order. And this is really important. I also want to stress that even if your business qualifies as a critical business, you must comply with social distancing requirements at the workplace and allow employees to work from home as much as possible. So and again, if that means operating 2 or 3 shifts, if that means allowing 1/3 or 40% of workers to work from home, just because the business is critical doesn't mean that it's run the same way it was a week ago or a month ago. The more that we can do that, the faster that we can get through this crisis. I'm now going to begin sharing some of the information about this crisis that we are acting on here in our state with the hard data that we look at. This is only a summary, right? We have kind of gotten it to a level where we think it can be informative to the public without being distracting, but we look at so many data sources every day. I want to thank in particular Dr. John Samet, who has joined us today here in the audience. He's the Dean of the Colorado School of Public Health. I want to thank his entire team who've worked very hard to put together this modeling data in partnership with the University of Colorado School of Medicine and the Colorado Department of Public Health. So first we have an update on the number of cases in Colorado. This is the information that we release every day. Today we now have 1,734 confirmed cases, 239 Coloradans hospitalized, 31 deaths, and over 11,000 people tested. Now, as we get into this description, you'll see that the number of cases, while the media will continue to focus on that, that's far from an exact number because we know that that is several times that number in Colorado. The key trailing indicator on what we're building capacity to address is how many need to be hospitalized and have medical intervention to save their lives. And there's a lag factor there, which I'll talk about as well. What this shows is this affects people of all ages. And you know, there's, again, a lot of misinformation out there. We've heard people say, oh, if I'm not over 70, I don't need to worry. That's not true. Of course, people over 70s and their 80s, people with respiratory conditions are far more likely to need medical intervention to stay alive, and they also have a higher fatality rate. But as you can see, this has affected Coloradans in every age group. And if you see the blue bar there, there's been Coloradans hospitalized, people in their 30s, people in their 40s that are hospitalized for this virus. Yes, lower percentage than people in their 70s and 80s, but a very significant amount, as you can see. 40 people between 50 and 60 are hospitalized, 25 people between 40 and 49. So this is important for all of us, and it's important for your health. It's not just theoretical. Those that are most at risk need to stay at home at all times unless they're seeking medical care. But we all need to be as prudent as we can in avoiding those interactions that can spread the virus. Next slide. So we're going to talk a little bit about the R0 value, which is a key component of any equation. What that really means is the number of people that one person is likely to affect on average. Let me bring this a little bit closer here. The number of people that one person is likely to affect on average. For example, if one person spreads it to two people spread it to four people, that's an example of what that works. We believe that in Colorado, the R0 value is between 3 and 4. Based on the data, the epidemiological data that we have, we hope it's closer to 3. We'll run through that data. Now, the R0 value is a function of two things. The innate properties of the virus, meaning how does it spread through a cough, how long are you contagious, how far does it go, how long does it last, but also the social and environmental parameters of any particular place. Like it can be affected if one place is drier or colder, or if you live in a society in which people shake hands instead of bow to one another, or a society in which people hug or kiss one another as a greeting. All those things are the social determinants of the R0, and combined with the virological determinants of the R0, they determine what that is in any scenario here. Our goal is to reduce the effective R0 value in Colorado as hard as we can. So again, it starts between 3 and 4 in Colorado based on the data we have, and each of these social distancing measures significantly reduces that. This is a visual representation of what R0 means. This is an R0 of 3. One person coughs, 3 people get it. Each of those 3 infect 3, each of those another, and so on. You can see how in many areas one single case can lead to hundreds or thousands of cases, and the growth can be exponential. That's why acting quickly and boldly is absolutely critical towards doing this. Next slide. This is another very important slide because it shows the lag factor in anything that happens to showing results on the different levers that we're looking at. First of all, it's 4 to 5 days from exposures to symptoms. Now keep in mind, some people might have minor symptoms or be asymptomatic, but that would be a similar incubation period to where they might be contagious, or 4 to 5 days to fever and traditional symptoms. Symptomatic till when it shows up on the Colorado reports. If it shows up 8 days, this is very important now. Onset to ICU admission, 10 to 12 days. So what that means there is exposure to ICU admission is 14 to 17 days, adding that first and third one together. So what that shows is there is a significant lag factor, and we'll get into what that means as we know what to look for with the additional distancing steps that we've taken. Onset to death greater than 2 weeks, and the average length of ICU stay is 8 days. This is the chasing a ghost concept, which I talked about a few days ago, but it's putting some hard numbers to it. We will see the effects of what we did 12 days later, 15 days later, in terms of what we have presenting itself at our hospitals in need of medical intervention to save their lives. The next slide is where we, based on our best data, where we show the social distancing impacting and the levels that we have reached and will reach. Some of the initial measures, schools, restaurants, bars, casinos, ski areas, that will have showed about a 25 to 40% increase in social distancing in our state. We then went to restaurants and bars closing, gatherings, 50% reduction in the workforce of non-critical, prohibition of in-person gatherings. That is somewhere in the 40 to 60% range in reducing the spread of the virus. The stay-at-home, we won't have the hard data yet. It just started, but we are hopeful, and early indicators are that that will be about an 80% social distancing. How do we track this? There's several feeds of data that are coming in real time. We have a great data team with our Innovation Center led by Tim Miller, who's volunteered full-time and is working on this. We have metadata from GPS pings on cell phones that's provided by commercial subscription services that we have access to. We have traffic data that's aggregate from how many people pass certain points at certain time. It's data that's always been around. We've used it for traffic planning. We're now using it for public health. We hope that there are even more meaningful data streams that come online in the coming days so that we can effectively model how this is affecting the actual movements and interactions of people and saving lives. The next slide is very important in setting expectations for the general public and for the media, because what we want to show is when we will have an impact from each of the steps that we have taken or are taken. So you might recall one of the first steps was cancellation of gatherings of 250 and up. That will be showing up or has shown up in the last day or two, March 25th. Closure of bars and restaurants, which we took March 16th. That will start showing an impact. The impact will peak March 28th. Keep in mind there can be some impact a day or two before, right? It might have a low incubation period in some, but the biggest part of that impact really won't be felt until that impact date that we're showing. The school closure, March 28th. Prohibition of gatherings of 10 and up, which went in March 19th. You'll start seeing that in the data March 31st. The Colorado-wide school closure, which was March 23rd, some of those rural districts that hadn't closed, that will start showing improvements April 4th. The 50% workforce reduction for non-critical, which went in March 24th, will show results April 5th. And the stay-in-place order, which went in March 26th, will show results April 7th. That will be when the results are fully articulated. So that's important, right? Because it shows when we will see that observed impact because of the incubation period, because of the time to report date or need for admission to a hospital. It's really important to keep that in mind. That's the ghost we're chasing with real-time proxies, more data around who's moving and where. We have some information early on, but we don't know the true impact until 12 days or so after a particular measure is taken. As Wayne Gretzky said, You don't skate to where the puck is, you skate to where the puck will be. And that's what we are doing through these public health measures. Next slide. The impact of social distancing on the R0. To understand the data about how we're containing the spread, the R0 value is effectively how contagious we think the virus is at the beginning of the epidemic in Colorado. The data shows between 3 and 4, our scientists' best estimate of where we are, given our normal level of interactions, given our weather, given our humidity. That's what we're seeing. That is higher than in some areas of the world where it was 2.5 or so. It could also be lower than other areas of the world where people have more interactions every day. It's also a function, of course, of population density would be another key variable in that. But when social distancing is introduced, we arrive at a reduced effective R0. The goal of this, to reduce that R0 so one person doesn't give it to 3, 3 to 9, but we significantly reduce that number, reducing the total number of infected and slowing the spread by pushing back the peak of when that infection occurs. The next few slides are going to walk us through our modeling and data. This is the information that I had with as well as the assumptions going into this when I made the decisions that I'm making, including the stay-at-home order. I hope it's also the information that ensures that you comply with that stay-at-home order. Next slide. It's also important to know what we're buying time for. Colorado has 1,849 ICU beds. We estimate that about half of those are going to be able to be used for COVID-19. That is pushing off the elective procedures to free up some of those beds. It's the impact of the social distancing on also reducing flu and other infections that might normally use some of those beds. It's also seeking to step down wherever clinically possible, step down to less than an ICU bed. All the hospitals are being very aggressive on those protocols. Our goal is to add 1,000 additional ICU beds by May. We have our emergency operations team, and I'll talk about how that looks and how they function, working on that every day, and 5,000 additional ICU beds by summer. Prior to my executive order that canceled elective surgeries and procedures, the normal percentage of beds that are full is over 80%. So if we have 1,849 beds, we freed up about half of them for COVID-19 patients. Normally that number would be around 80%, but hospitals are being very aggressive in doing what we can to free up existing beds for COVID-19, keeping in mind that our hospitals still need to do everything they do day in and day out. People are still getting heart attacks and strokes and appendicitis and all of those normal things that people need those beds for. But by using aggressive step down, by the social distancing, also reducing other conditions, and by the additional steps that we're taking with the elective procedures, we are freeing up more beds for patients. The goal is 1,000 beds by May, 5,000 beds by summer. So let's look at how that tracks with what we need in Colorado based on the data from the CU model. Continue. If the R0 is 4, of this virus in Colorado, and we're going to walk through if it's 3 and if it's 4, and keep in mind that our best data shows that it's between 3 and 4. If there was no social distancing, the peak ICU demand at the end of April would be 13,800 beds. We have 1,849. We want to add 1,000 by May, so you see a significant gap in the number of beds. With a starting R0 of 4, if we succeed in 40% social distancing, we need 9,400 beds. If we succeed in 50% social distancing, we need 7,300 beds. 60% social distancing, 4,500 beds in June. The reason the dates are different, you see May, late May, June, it's because the social distancing does two things. It delays the peak and reduces the number of people infected. Both are reflected in that. Next slide. What does this mean in terms of deaths in Colorado? With no social distancing, business as normal, if the virus continued to have an R0 of 4 in our state, we would have had 33,200 deaths by June 1st. Now keep in mind the normal death rate in Colorado is only about 100 people a day. So this is a lot of people dying. That's in addition to the normal people who would die 100 a day, 33,200 additional deaths from COVID-19 by June. With 40% distancing, 26,000 Coloradans would die. With 50% distancing, 19,900 Coloradans would die. With 60% distancing, 11,500 additional Coloradans would die. To give you perspective, that's larger than the population of 46 counties in our state. And these aren't just statistics, these are actual people. There are tens of thousands of aunts and uncles, of people of all ages, of grandparents, of brothers and sisters. And we can save lives quickly, and we are, by staying at home. Next slide. We also ran the data, which was presented to me, for if the R naught, the inherent R naught, the basic R naught in Colorado is closer to 3 under normal social conditions. Again, the scientists are telling us it's between 3 and 4 in Colorado, based on the hard data of how it's spreading. So we know how it's spreading in Colorado, limited of course, but real people, real numbers. If the R naught is 3 under normal social conditions in Colorado, with no social distancing, the peak ICU bed capacity demand would be 11,600 in June. That's a time frame that we would hope to be at about 5,000 or 6,000. So it would exceed our capacity by 5,000 or 6,000 with no social distancing and an optimistic assumption about the baseline contagiousness of this virus. With 40% social distancing, we require 5,600 by July, 50% social distancing, 3,300 by September, and 60% social distancing, 900 would be the peak by December. Again, you're seeing those dates because part of what the social distancing achieves is pushing off that peak. The peak still comes, but it delays it as well as reduces its severity. We're going to talk again about what those peaks look like in a moment, but I now want to show a similar one about lives in Colorado. If the R naught, it starts out at 3, that means how contagious it is. Our scientists are telling us it's between 3 and 4. If in fact it's 3, if there's no social distancing, there'd be 23,000 estimated deaths by June 1st. This is where we can see a lot of lives saved, and really, again, what drove me to immediately take these measures based on this data. The R naught of 3 is still optimistic, but it's realistic. If we do 40% social distancing, 1,600 additional Coloradans would die. 50% social distancing, 800 Coloradans would die over the norm. And 60% social distancing, we get that down to 400 deaths above the norm from COVID-19. This is the impact of the average infected Coloradan infecting 3 other people at a base level, and then reducing that as a function of the different social distancing measures that we are taking, have taken. This is a really important, this is closer, this is closer to what success would look like in Colorado. Hoping that the R naught inherently was closer to 3, and that these distancing measures buy us the time to avoid 23,000 Coloradans dying from this virus. Continue. The red line, this is a graphic representation of some of what we worked through now. The red line indicates the capacity of ICU beds. That's the dotted line. The lowest is what we have available right now, about 50% of that 1,800. The middle red line is what we hope to have on board by May, about 1,000. The high one is the 5,000 goal that we want to get through by the end of summer. You can see that in the R naught 3 scenario, the aggressive social distancing plus building ICU bed capacity can make it easier to avoid unnecessary deaths, that is, people that die because of lack of medical treatment, ventilators and beds that we have in our state. But the peak still comes. The peak comes later in that scenario. And we know that we can't have any kind of extreme measure in place that long. That's why we issued the stay-at-home order early. It's a blunt force instrument that allows us to knock it down and then ease those restrictions so we can return to a free market. People can earn a living. People can have normal, as close to normal, socializing sooner rather than later. Next slide, please. The more we can hammer down that R naught value, the more time we have to build additional capacity, beds, secure ventilators and medical equipment, as well as reduce the spread. The goal of the stay-at-home order is to bring down how contagious the virus is, that is the R naught value, as much as possible to save lives and return to normalcy as soon as is possible without costing additional lives. When we are successful, we will be able to resume normal activities, but the virus will still be with us, and we'll have additional precautions in place about how that new normal looks when we're able to return to that new normal after we knock it down with these initial steps. So what does success look like? It's important to define that. Nobody should be under the illusion of that success is that the virus is gone from our state in a week or 2 weeks. That's not success. What success means is our hospital system has the capacity at the point in time needed to treat patients and save lives. It means we don't have a catastrophic breach of our healthcare system, bodies lining up, unable to access beds or healthcare and dying. It means we have planned for hospital surge capacity, testing, personal protection equipment, and supplies. And I know most urgently for most of you, because most of you will not get the virus or will be able to have it at home with minor symptoms, most urgently, this path of action will lead to the quickest possible return to work, to productivity, and to social and economic normalcy. This is the quickest path from A to B. Once we knock down the RO value as much as we can, we want to implement the South Korea model. South Korea doesn't function the exact way it functioned 2 months ago, but most people are able to go to work, earn a living, and it's generally functioning as an economy in a way that America is not right now. South Korea's key to success is widespread testing, contact tracing, surveillance, all epidemiological activities that we're doing with this crisis, that we're scaling up rapidly, and that we need to do on a regular basis as the short-term closures roll off and we're able to return to closer to our normal economic and social activities. As a result, South Korea has a largely functioning economy at this point. They're dealing with a problem on a case-by-case, cluster-by-cluster basis, instead of with widespread lockdowns and disruptions of economic activity, which is where we want to get here in Colorado. Next slide. The Daily Sentinel editorialized today that if we look back on this time and wonder if it was overreaction, it will be proof that Polis did the right thing. That's, again, we hope that we are preparing for what comes ahead because, of course, I, like you, would rather end up with more masks left over at the end of this than to leave people without masks and infected and dying. I'd like to have an extra ventilator, one extra ventilator rather than one too few. We'd rather have extra beds than too few. That's what preparedness means. It means being able to handle the surge. If we get this right, some might say we did too much, too soon. And I'd much rather be the recipient of that complaint than to have a full-scale public health disaster with tens of thousands of Coloradans paying the ultimate price. That's what the data shows us that we can do. We want to make sure that we can return Colorado and you to being able to work and produce and earn a living so you can pay your rent and buy food as quickly as possible. The federal government has bought us time by sending out $1,200 to everybody listening to this except for some very high wage earners per person, $500 per kid. So a household, 2 adults, $2,400, 2 kids, $3,400, one-time payment. That's critical because we know that if you can't earn a living, you still need to pay your rent and put food on the table. It's not enough, but it's a very important step in allowing states like ours to be able to take these measures that we need to prevent tens of thousands of Coloradans from losing their lives and to prevent a longer-term disruption to our economy and way of life, which is as dangerous as the loss of 10,000 lives. Both of those are dangerous. If we have hundreds of thousands of people who lose their homes because they can't make rent because they lost their jobs, that's a significant danger as well. So that's why we're acting to reduce that time, to minimize it. We're grateful that the federal government came together. Mitch McConnell, Donald Trump, Nancy Pelosi, Senator Bennett, Senator Gardner, all working together to be able to get this done and give us that breathing room and that leeway that states are using to save lives in this. I also want to take this occasion to update you on what our command structure looks like. That's this chart over here. Each one of these boxes is a function, not necessarily a person. This is our Emergency Operations Center and response team here in Colorado and what it looks like. We literally have thousands of people working through the Emergency Operations Center, also in our communities, county health, with our federal partners. That's the National Guard, Army Corps of Engineers, already on the ground here in Colorado to make sure that Colorado is successful. This similar structures have seen Colorado through other events, floods and fires. We had to, of course, optimize and modify this to better take on this crisis at this time. Key sections are public health branch, planning section, and operational section that takes the work and makes it actionable. That includes things like logistics that gather personal protection equipment, move it around the state, gather testing, move it around the state. We sent out 4,500 test kits in the last day or two. There's rapid acquisition of more. We have one of the highest testing rates in the country. The planning section looks at short-term planning and long-term planning, thinking about where we want to be in the months to come. I'm in touch through the command structure with all aspects of this team on a regular basis with daily update calls from multiple units. At the top of the structure is our leadership and policy team that have an ongoing conversations on an hourly basis. I want to thank my Chief of Staff, Lisa Kaufman, for her tireless work. I want to thank our counsel, Jackie Melmed, who's here as well, the members of my cabinet, all of our state workers, most of whom are now telecommuting from home. We are continuing, of course, the business of government, and we're taking steps to offer better customer service in this crisis. Today we did an executive order in addition to allowing bussers and waiters and restaurant staff to deliver. We also took an order allowing people to get marriage license without having to go in person. So if the date of your nuptials is imminent, you might have to have the celebration later, but the good news is you don't have to go in person to your county clerk. You can now do that and without putting you and your fiance in jeopardy. These are the kind of steps that we're taking every day to reduce hurdles, reduce red tape, reduce bureaucracy, reduce regulations that might make sense in normal times, but don't make sense in this crisis time, to allow people to do as close as what they can to your normal lives while keeping with all of these social distancing protocols. I'll just end with some of the numbers. We have about 900 ventilators in the state of Colorado. We need about 7,000. We have about 1,800 hospital beds, about half of which are freed up for COVID-19 with the aggressive measures around delaying elective surgeries. We need about 5,000. ICU beds. A lot of our work here at the EOC, a lot of my work in talking to CEOs of companies and leaders and many others is about marshaling those resources that we need for what we know is coming in the days and months ahead. We want to prepare for the worst realistic scenario, and we hope that we can be effective, and we hope that we can help prevent that worst case scenario from occurring here in the state of Colorado. Thank you all for joining us. Please stay at home to the extent that you can, and together we're going to get through this. Thank you. Stefan.
Governor, are you frustrated right now with the lack of apparent compliance with the stay-at-home order? You drove down here, obviously. There are a lot of people out still, and we see that at grocery stores and hardware stores and that kind of thing.
So we are seeing increased social distancing. That's good, but we need to see more, right? The reason that we needed to go to this level is we were only seeing around 50% with the previous level. This needs to get us to that 70 to 80%. So it really relies on individual participation, right? Again, it's not a contest to see what you can get away with. It's a contest to see how few interactions you can have to get by for the next couple weeks. That's what this is about. Let's act now to save lives. The less compliance this is, the longer it will have to last, the greater economic damage there will be, the more people out of work there will be. So if we care about the economy, if we care about the free market, if we care about the private sector, we need to do our very best to comply, in addition to the lives that will save.
Governor, recognizing the numbers are not totally accurate as you shared with us, we're now 3 weeks in, 3 weeks since your first news conference. Give us some perspective on what you expected when you talked to us back in early March to now. Are you pleased with the numbers? Did they exceed what you expected 3 weeks ago? are they on target?
Well, because of those delays in the data, we are just starting to see, for instance, the next couple days, the impact of closing bars and restaurants. We won't see the true effect of the 50% of workers not going to work for another 9 or 10 days, of the stay at home for 12 days. So that's the chasing the ghost that's so frustrating here. But the initial data sources, the real-time proxies that we use, yes, they're encouraging, but they're not enough, right? So again, the real-time positioning from GPS pings of people, the traffic figures that we're getting, encouraging, but we do need to do better. We need to challenge one another to avoid social interactions with those outside of our household to the greatest extent that we can to minimize the duration of these extreme measures and save lives. Phone question, please. Phone question?
2595, you should be unmuted.
Okay, in-room question, yes.
Is there any plan to use, to create any field hospitals or utilize stadiums or convention centers, either for people who are sick,
Yeah.
hospitals exceeding capacity, or even the homeless?
So all those things are being undertaken. I mean, whether it's the city of Denver looking at different contingencies like the convention center, whether it's us looking at all of our college dorms that we have ready to go, these are not going to be the ICU beds for sick people in college dorms. What they could be is a step-down facility for people that are discharged, but might still be contagious and need to be quarantined. For instance, seniors. They could also be an area for people who've been exposed to be quarantined. So we're looking at deploying all of those, but separately we're looking at working with our hospitals around building the beds and adding them as soon as we can. The Army Corps of Engineers is on the ground working with us, and we have those goals in place. 1,000 by May, 5,000 by the end of summer. Telephone, please.
Hey, Governor, it's Marshall Zellinger at 9 News. I've heard from employees that they have two different scenarios. One is they believe they're being asked to work for a business that isn't critical, but the business is trying to pass itself off to its employees as critical, and employees who want to work from home, but the employer won't allow that. What recourse do they have, or what
Yeah.
message do you have for those businesses?
Yeah, that's against the law, and those businesses will be shut down. So please report them immediately. Every business, including critical businesses, have to maximize social distancing. That means if you're a critical business, you need to allow telecommuting to the extent you can without sacrificing your operational capacity, and you need to do everything you can for spacing it out at work. That means if it means going to 2 shifts, like if you're a construction site that's deemed critical, you are not allowed to operate with 1 shift if you can split them up and operate with 2. So county health departments and others will be acting to shut down some of those critical businesses if they're not complying with this order, which requires them to engage in social distancing.
We're getting a lot of questions from viewers from Coloradans, and one was specifically, would you consider, do you have the authority to ban out-of-state visitors from coming to Colorado? There's concerns about people coming here for spring break.
We do not control the borders of our state. We have 2 Native American tribes in our state. They have locked down their borders. They're independent nations, the Southern Ute and the Ute Mountain Ute. But Colorado does not have control over interstate commerce per the U.S. Constitution.
It seems like the message that you'd like to get across, and I want to put words in your mouth, is Colorado, you haven't seen the worst of this yet.
Yeah.
Follow this stuff, but I mean, it sounds like we're in for quite a bit of trouble before things finally get better.
Colorado hasn't seen the worst of this, United States hasn't seen the worst of this, and the world hasn't seen the worst of this. So be braced, be ready. I want people to also to keep that optimistic spirit. While there will be loss of life, and we hope to minimize it with this actions, by working together, we can reduce this disruption to our economy. Many people will be able to return to work in a matter of weeks and months as these additional safety protocols are put into place. We're going to get through this. There's a light at the end of the tunnel, but it's really important that we work together to contain this global pandemic and that it doesn't take the lives of tens of thousands of Coloradans before their time.
Governor, state Republicans have aired some frustrations with some of your decisions. Your reaction to what they're saying?
Yeah, these aren't Republican or Democratic decisions. I think that Republican and Democratic leaders have been responsible in echoing the guidance of staying at home unless absolutely necessary. And that's what's most important here, is that people stay at home unless they absolutely have to go out to get, for a necessity. So there's been responsible comments from people on both sides of the aisle, from Democratic and Republican governors, from Democratic and Republican commissioners. I think what many wanted to see on both sides is clarity. I think the uniformity is also important, because what you hear from a few parts of our state is, look, the virus isn't here yet. And by the way, it's in a majority of counties, but there's a few places that it's not. Why do we have to shut down our stores? Well, here's the answer. If the entire Denver metro area is shutting down and you don't, there will be a huge influx of people from all over bringing the virus to your county. And your county will rapidly go from having no virus to having among the highest rates in the state, because of the increased traffic that will occur if we don't take these preemptive actions. So I encourage everybody to look at the data and science first, to act responsibly in this crisis. Everybody wants to get through this disruption as quickly as we can. This is devastating economically to families who've lost their jobs, who are losing their jobs, who can't earn a paycheck. The best way to get through this is to succeed in staying at home to the extent possible in the coming weeks. If we can do that, Colorado can be in the forefront of saving lives and of the economic recovery.
Can you explain how you came up with this? Are we okay now?
Yes.
Can you explain how the state came up with this R naught, as worldwide it's just below 2, we have a 3 or 4.
Yeah. So the R naught is a function of two things, right? It's the innate virological factors in terms of whether it's what it's in your sneeze or your cough. The other factors that affect it are how society operates in the physical environment. Colorado is dry. Colorado has been cold. Those things affect it. Coloradans, unlike in Asian countries, traditionally greet one another by shaking hands instead of bowing. So those are the kinds of factors that affect it. Population density of the Denver metro area, how people commute to work, use of public transit, all those things go into what forms an effective R naught. It's possible, we will see, this is why I think New York was so concerned. It's possible it could have been even higher in New York, given the way they live and operate together and interact. An individual simply comes into contact with more people in a day in New York than they might in Colorado. So that would be among the reasons that it could be higher, but these are not hypothetical. Our estimates of it being between 3 and 4 and hopefully closer to 3 are based on the actuals in Colorado of watching the virus spread and watching those numbers. The reasons and how they each impact it are theoretical, but we've seen it happen, and we're going to continue to revise our models as we see what it is under these social distancing techniques. Telephone? Telephone?
Governor, this is Corey Jones with CPR News. I'm curious, how far down the road are you all looking? Do you expect this to come back around? Is that part of your planning at all?
Well, the initial order is through April 11th, as you know. We're going to, if we can end it sooner, we will. And if it has to go longer, it has to go longer. Everybody in Colorado, I think I lead the pack in wanting to end this as soon as possible. This is horrible. People not being able to earn a paycheck and hike with your friends or have a party. I mean, this is really bad. And I know that the frustration level will only rise over time. So the answer is as soon as is possible. And it may take longer than April 11th. And if somehow people are complying better and we shut it down, it could even be sooner.
Governor, I want to follow up on Marshall's question. Who do you report these businesses to, one, and then also a separate question, you talked about the fact that the state's thousands behind on the ventilators
Yeah.
and the critical care bed needs. Are we any closer to implementing the plan essentially for life-saving measures, the critical care plan, I believe it's called?
So a good place to report, if you work at a critical company that you believe could do more social distancing or telecommuting or stagger work schedules, report it to the Attorney General, COVID-19 at coag.gov, or your county health department, or both, frankly, and then we will get on those. And companies need to take this very seriously. If there's bad employers out there that are just saying somehow we're exempt, no employer is exempt from this order. If you are critical, you are required to do the maximum social distancing you can. That means you have to allow telecommuting. You have to go to multiple shifts if you can, given what, if it's IT support and the time is needed at one time and it's critical, you have to have them there. But if it's something like construction, you go to 2 shifts or even 3. You have to do that under the law of Colorado, or your county health department is likely to shut you down.
Governor, you talked about 1,000 new beds by May, 5,000 by this summer. How, where's the money coming from?
All of the money for beds and ventilators is trivial compared to the economic cost of shutting down our state for even a day. I mean, we are a productive state, hundreds of millions of dollars of economic activity every day. This is a rounding error. If all of these beds and ventilators and everything we're doing helps us open up 1 day or 2 days earlier, it more than pays for itself. We actually have access to emergency funds from the first federal bill that they passed. We're still parsing the second federal bill. We also have state emergency funds that we went to right away that are normally used for floods and fires that we went to for these purposes. Telephone?
Hello, Governor. This is Jennifer Olin with the Washington Post. Is drive-through testing still happening with the state's cooperation across Colorado? And if not, why not?
Yeah, there's a lot of expanded drive-through testing across the state. We've been at about 10 sites with our state testing. Many of our providers are offering drive-through testing as well. Some of that has to go, if they're not prioritized, those tests often get sent out to LabCorp and Quest, which means there's a 4 or 5 or even 6-day turnaround. We are rapidly scaling our in-state processing of those tests, prioritizing clinical need and those healthcare workers that we need back in the workforce. But we want to continue to scale up. Again, testing can be site-based, literally drive-through. I mean, you drive through, or could mean you get out of your car and go to a site. But between that, there's already several dozen centers across Colorado doing testing. Kaiser, UC Health, many of our partners, Centura, any site that can do testing and send it out to LabCorp or Quest. The state lab, again, the state drive-through testing is supported by the Colorado National Guard. They're doing an amazing job keeping that in order, and that is only scaling up over time. We sent out 4,500 test kits to our counties 2 days ago, with more on the way. Yes.
You said that people should still recreate, quote, regionally. You said that doesn't
Yes.
2 to 3 hours.
Right.
But a couple things. One, what does regional mean? I mean, can you put a number on that, miles or time? And then also, we've seen some parks pretty overwhelmed. Some trails don't allow for 6-foot spacing. Are some parks or outdoor spaces at risk of being shut down?
Yeah, if there are trails that don't allow for 6-foot spacing, it depends. Those could be managed by counties. If they are managed by the state, we would have to look at shutting those down. So most trails in the state are managed by county open space or municipalities. The state, of course, through our state park system, also has some that they're generally larger areas. And yes, people should recreate near where they live. And that, again, it means different things depending on where you live, right? But if you live in a city, you certainly shouldn't be leaving your city to recreate. You should use your municipal parks at off hours. I've encouraged municipalities to expand the hours of operations of those parks to further spread it out. But it also generally will mean recreating less during this crisis. This is not a vacation, it's not a holiday, right? And there's certain kinds of recreation that are inconsistent with reducing the spread of the virus. And that's why playgrounds are being shut down across Colorado. They have surfaces that can contain the virus live for up to 3 days. People shouldn't be playing in groups, basketball as an example. You could play one-on-one with a housemate, but not a full team basketball. Frisbee, again, with a housemate, but not Frisbee tag or ultimate, right? So it's about using common sense. What is it, Maria? Oh, well, not, yeah. So it's about using common sense to try to engage in the necessary recreation you need as close to home as possible. Telephone question?
Hi, Governor. It's Matt Morrow with Fox 31. Are you using smartphones geolocation data from Facebook, Google, or any other company for public health purposes, particularly that people may not know about?
Yes, we get them from subscription services that aggregate that data. So it's from multiple sources, including GPS, weather data. I don't know if Facebook per se is one of those that supplies that data behind it or not. But the answer is yes, we are using commercially available data that the state is subscribed to that gives us GPS ping data from that provides a sampling of how people are moving and where. And just so Coloradans know, none of that data that's commercially available is individually identifiable. This is not a privacy thing. This is aggregate data that we're talking about that we use that's been commercially available for years, but we are now using for public health purposes. It's the kind of data that was often used in the past around planning for retail or roads or urban planning, but we are using it in a new way, and we're seeking out new data streams to help us manage this public health crisis.
Governor, can you give us an update on your relief fund, the dollar amount?
Yeah.
Have you determined where it's going or when?
Yes, over $7.5 million has been raised, helpcoloradonow.org. And Maria, was there an announcement made today on that? Yes. Applications are now open. So Colorado Now, helpcoloradonow.org. It is now going to be dispensing, immediately prioritizing childcare for critical workers, because we need people that are nurses and doctors and cleaning our hospitals and first responders to be able to go to work without the schools functioning. They need to have that capacity because we need them. That's live now. $7.5 million. Thank you to the Denver Broncos and many others for stepping up. Colorado Health Foundation as well. Phone question?
Hello, Governor. It's Rich, CBS 4. I was only able to join this conference a short time ago, so I don't know if this has been asked, but have you addressed what is going to be done about the homeless congregating together, which seems to be a place that this virus could spread easily?
Yeah, we're engaged with the municipalities, Denver and others, about that. Many of them are looking at converting venue facilities and others that aren't operating to provide temporary housing for those who are housing insecure or who those are on the streets. There's a lot of other, we took some actions. Alex asked the other day about prisons. You saw some additional actions on that. Some of the very first actions we took were around nursing homes, long-term care facilities. So all of these are happening in sequence, certainly prioritizing areas that have a high population density.
Governor, I wanted to ask this again. You talked about the deficits in the ventilators and the critical care beds. Are you inching closer to signing the crisis standards of care plan? Colorado, how are you thinking?
Oh, yeah, so we are looking at all of those contingencies around how to limit our limited supply. One of the things we're looking at is changing the protocols for ventilators, which has been done actively in New York to allow 2 people rather than 1. That would be a clinical decision made by doctors. We're not making the decision. We would simply be allowing it. So we're looking at all of those kinds of things. Colorado does not have a standards of care operative statute, so it would be up to a governor to issue guidance, which we won't hesitate to do. We're not at that point yet, right, because of this lag factor, because of the impact. We hope not to be there, Jesse, but yes, we would offer that ahead of when it was needed. Telephone? Last telephone?
There's no more, sir.
Okay, last in person?
Are you urging other governors to take a similar course and statewide stay at home? This needs to be a national effort, many public health experts say, and
Yeah.
many states are not doing what Colorado is.
Well, because of the freedom of travel in our state and because of the fact that people are allowed to cross borders, yes, we absolutely need to coordinate in other states and other places, right? So while several nearby states have taken these steps, there's others that haven't. It is really important that at the appropriate time and for the minimal amount of time possible that we take these steps nationally and internationally as well. We're able to have more control over our international borders. But again, our domestic borders, with the exemption of our native tribes, which have closed off their borders, we, because of the U.S. Constitution, don't have control over our state borders. Thank you all very much. We'll look forward to an additional update in a couple days.